Swayam Prabha. Digital India. Educated India.
Welcome to the session of the course Therapeutic Nutrition. This is the sixth module, that is Nutritional Management of Food Allergy and Intolerances. And this is the first lecture in which we shall be studying about nutritional management of food allergy. I am Dr. Jaspreet Kaur, presently working as Assistant Professor in Government College for Girls, Ludhiana, Punjab, affiliated to Punjab University, Chandigarh. And this project is funded by DTH Swayam Prabha, MHRD, New Delhi. In the last unit, we had studied about nutritional management of non-communicable diseases, in which we covered diabetes, metabolic syndrome, hypertension, and cardiovascular diseases such as coronary heart disease. In this lecture, we shall be studying about what are allergic reactions, and then we will see what is the classification of the immune reactions. Then we will study what are the different types of food allergies, and lastly, we will study about the clinical features of the food allergy. All of us, we have come across certain persons when they consume specific kind of foods, they report immediate physical discomforts, such as they would experience vomiting, diarrhea, or they would develop cramps in their tummy, wheezing could be there could be swelling of the airways, and there could be severe drop in the blood pressure. These are the general symptoms. And we also see some kind of persons, they say they cannot tolerate certain kind of foods, such as some people, they cannot tolerate milk, or some they cannot tolerate wheat products. They develop gas, bloating, and abdominal pain when they consume certain products. So in certain conditions, uh, there is a link of food with these adverse reactions. So food allergies and intolerances, they can actually cause more harm just when we compare it to getting ordinary gastrointestinal symptoms. Many a time there is no obvious symptom till the time some chronic situation crops up. So let us study about different type of food reactions and their cause and effect and management. So what do we mean by adverse reaction? It is a general term which indicates a clinically abnormal response or reaction when we are exposed to a food regardless of the mechanism. Now these foods, they can cause a variety of reactions. Some of them, they can be life-threatening. However, most of the reactions are less severe. And these reactions, they can be categorized into different categories. Let us see what are these categories. These adverse food reactions could be because of some food toxicity, or when the food is not toxic. Let us see what are these categories. So let's understand what are these adverse food reactions in response to toxic food and non-toxic food. When the type of infection or the intake is of toxic origin, it could be because of bacterial or fungal toxins, or it could be because of some other natural or added food toxins. And when it comes to non-toxic food reaction, we call it hypersensitivity. Now, this hypersensitivity can be manifested in two forms. So the first form will be known as allergic hypersensitivity, and the second one will be known as non-allergic hypersensitivity. So when it comes to allergic hypersensitivity, it will be manifested with the help of either one of the immunoglobulin. We shall be studying it later. It is known as IgE. it is IgE mediated, and the other type of allergic hypersensitivity would be non-IgE mediated. And this type of IgE mediated representation is when the person is allergic to food, or he is trying to get rid of the helminthes, that is the worms. And non-IgE mediated, they are when the IgG, that is immunoglobulin G and immunoglobulin M complex, they are joined together to develop some reaction, or it could be only IgG mediated, or it could be T cell mediated. We shall be discussing it later. And when it comes to the toxic type of reaction response, it could be categorized as food intolerance, or it could be because of some food additives, it could be because of some food irritants which are present, or there could be some digestibility issues where the person is not able to digest these things because of some psychological issues or some kind of drug reactions. So let us discuss toxic and non-toxic type of food reactions in detail. These toxic food reactions, they could lead to food toxicity or poisoning. These toxins, they are released from the contaminated food or the microorganism, such as it could be bacterial toxins, fungal toxins, chemical toxins, etc. So let's discuss the hypersensitivity. Adverse food reactions that involve a response due to intake of specific foods, they are classified as hypersensitivity, which we commonly call a food allergy or food intolerance. So what is difference between food sensitivity and food poisoning? Food poisoning is generally resulting from spoiled or tainted food, and it will affect more than one person eating the same food. Whereas when we talk about a food sensitive person, he may show the reactions where others are absolutely able to tolerate that food. So let us discuss about allergic hypersensitivity now. And for that, we need to study what is the basic immune system. So let's try and recall the basic immune system. And for that, let us study about some terms. So the first term is antibodies. Antibodies, as we know, they are the immunoglobulins. They are the specialized proteins which are produced by the plasma cells of our body in response to an antigen or any allergen. And second thing is antigen. So what is an antigen? It is usually a foreign substance which could be protein, bacteria, virus, or any kind of polysaccharide, and they stimulate antibody production. So two terms, antibodies and antigen, is which will promote the production of antibodies. So let us talk about allergens. So what are allergens? They are the substances which are foreign to our body that on interaction with the immune system, they will cause allergic reaction. That is why they are known as allergens. Now there are 5 classes of antibodies which have been identified. That is immunoglobulin A, immunoglobulin D, immunoglobulin E, immunoglobulin G, and immunoglobulin M. So here it is important to study about immunoglobulin E. So it is an important immunoglobulin. It will help to eliminate the parasites, and it is responsible for classic allergic reactions which are commonly referred to as food hypersensitivity or food allergy. Now, it is a reaction that occurs when immune system reacts to normally harmless food protein that a body has mistakenly identified as harmful. It has identified it as its enemy. So we classify these immune reactions therefore as IgE mediated reaction. So these immune reactions, basically, they can be divided into four classes or types. The type 1, type 2, type 3, and type 4. Now, type 1, 2, and 3, they are antibody dependent and immunoglobulins which we had talked. Whereas the type 4 of immunoreaction, they are T cell dependent. We call this type of immunity as cell mediated immunity, which does not involve antibodies, but rather they will involve the production of T lymphocytes in response to antigen. So let us recall this type 1, type 2, and type 3. They are antibody dependent, whereas the type 4 is not dependent upon the antibodies, rather it is dependent upon T lymphocyte cells. So let's discuss about the first type, that is type 1, that is immediate hypersensitivity anaphylactic IgE mediated. This is a main type of reaction. This is a quick onset food allergy. The reaction occurs when the allergen reacts with the sensitized IgE antibody on the mast cell. We shall be studying about in coming slides. And it leads to another process that is known as degranulation of the mast cell, which will release many mediators such as histamine, cytokines. They will cause the adverse reactions. And in certain circumstances, Ig, it has been involved in this type of reaction. That is why it is known as IgE mediated. The second type is known as cytotoxic hypersensitivity. In this reaction, the IgG antibody, it reacts with the cell membrane or antigen, which is associated with the cell membrane and fixes complement, which leads to complement mediated cell death. But actually, this is not an important type of hypersensitivity, because usually it is not seen in the food allergy cases. The third type is antigen antibody complex hypersensitivity. Now, in this case, what happens is that IgG, that is immunoglobulin G, and IgM, they form complex to induce a complement fixation, and consequent local inflammatory response will happen. This will happen several hours after the exposure to the antigen. And this reaction may have a role in several food-related inflammatory responses, such as people who get colitis enteritis with bleeding or malabsorptive disorders, etc. Now let's discuss about the type 4 immunity, that is cell-mediated immunity, or it is also known as delayed hypersensitivity, because the reaction takes longer time than what we get from the other type of immunity. This reaction, it is mediated by the T cells, as we have discussed that they are not dependent upon the immunoglobulins. So these T cells, they will interact directly with the antigens. This type of reaction will actually have role in celiac disease, in protein losing enteropathies, then inflammatory bowel disorders such as ulcerative colitis. And it is important to note that it is the immediate hypersensitivity, that is the type 1 which we had discussed, which involved IgE, which is responsible for the classic allergic reactions. Now, how does this immunopathological IgE mediated process leads to allergic reactions? Let us see. For this IgE mediated allergic response, it has to follow three steps. The first step is known as sensitization. The second step is known as early phase reaction. And the third step is known as later phase reaction. Now let us study about these steps in detail. So when we come to sensitization, the body's immune system is normally able to react to the presence of toxins, bacteria, or virus by producing a chemical reaction to fight all these invaders. And we know uh, sometimes the immune system that reacts to ordinarily benign substance, uh, and it perceives as if it is its enemy. So sensitization, it is a first step when your body perceives that this is something which is not good for me. So that starts the process of sensitization. Say if our immune system, it is inclined to form IgE, that is immunoglobulin E, to certain foods, let us say peanuts or the milk, our body must be exposed to the food before we can actually have that allergic reaction. So in other words, people who develop allergies, they have an unusually sensitive immune system. So a true food allergy will occur when body's immune system, it will react to a protein from a particular food that has been swallowed. And this protein in this case will be known as an allergen. We see all of us, we have been eating a wide variety of foods, but this food is not allergic to us. But in these people, the Ig will be sensitized to produce special antibodies for, let us say, any kind of allergen. So these allergen, they causes the person who own antibody to attack that foreign substance. Now that foreign substance is that protein only. So initial exposure to allergen, that will lead to production of allergen specific immunoglobulin E production. Now, production of allergic specific immunoglobulin E, it will start a chain reaction of chemical changes, which will cause adverse reactions in our body. The reactions, they can occur either immediately or say within minutes, or it can take several hours. So we have already discussed. As the food is digested, it will trigger certain cells of our body to produce a food-specific immunoglobulin E in larger amounts. And the food-specific IgE will be released and it will be attached to the surfaces of specialized cell. We call them mast cells. Now here this cell shown is known as mast cell. So what is happening here? The protein which has entered, it has triggered the IgE response, and IgE has attached itself to the mast cell. Now these food specific IgE, they are released and they get attached to the mast cells. And next time when we eat the same food, it will interact with that food specific IgE on the surface of the mast cell, and it will trigger the cell to release the chemical such as it could be histamine. It is a key mediator to produce the allergic response. And again, on the repeated exposure, it will cause the production of more such kind of chemicals, which will cause smooth muscle constriction, mucus secretion, vascular permeability, sensory nerve stimulation, etc. So this will be followed by late phase reaction. Now, what is this late phase reaction? The allergens, they also stimulate the immune cells, such as they will stimulate the T cells and mast cells, as we have seen in the previous slide. What is the effect of mast cell? And these mast cells and T cells, they will produce inflammatory mediators. They will be known as leukotrienes and cytokines. Now, what is special about these newly formed mediators? They will act as at the post-capillary endothelial cells. That means the cells of our skin or the on the or top of the internal organs, and they will promote the outflow of plasma, which will lead to edema of that specific portion, and it will cause adhesion of circulating leukocytes and infiltration of the tissue by eosinophils, neutrophils, basophils. There are fighter cells. They will be attacking our own part of the body, and this will further take the allergy to a higher level. And within few hours, the infiltrating inflammatory cells, they will become activated and they will release mediators which will stimulate and enhance further inflammation reactions. Now, this condition is known as late phase reaction. So let us try and see what happens when we are allergic. If we are allergic to a particular food, the first thing we would feel is itching in our mouth. And when we start eating that food, because your body is not tolerating it. And secondly, after the food is digested in the stomach, a person may have gastrointestinal disturbances such as vomiting, diarrhea, or pain can happen. And when these food allergens, they will enter and travel through the bloodstream, they will cause blood pressure to drop. And as the allergen, they will reach the skin, they can cause hives or they can cause eczema. And when these allergens, they reach the lungs, they can cause airway obstruction, asthma, etc. So let's summarize how the food causes allergic reaction. What we have seen as a food, it enters our body and our allergen is absorbed and allergen is processed. Now this food allergen, it will be going to the antigen presenting cell and it will be attached to it. This will cause production of T cells, and these when the T cells, they are activated, we call it non-IgE mediated allergic reaction. And when it goes to B cell, and these B cells along with immunoglobulin E, they will cause immunoglobulin E mediated allergic response. They will go to mast cells and basophils, and this will cause to release of histamine. It will cause hives, vomiting, swelling, and breathing difficulty will happen. So the common gastrointestinal symptoms would be abdominal pain, nausea, vomiting, diarrhea, or there could be severe problems such as there could be gastrointestinal bleeding. It could lead to colitis. It could cause distension. Then protein losing enteropathy can also occur. And there are symptoms which are related to the skin or the cutaneous part of the body. Here, the person who is allergic to certain food, the intake would cause itching, flushing, or there could be hives, we call it urticaria, or there could be swelling of the blood vessels, which is known as angioedema. And it could lead to eczema, or it could cause inflammation of the skin, we call it erythema, or it can cause redness of the skin. And along with that, there could be symptoms which are of respiratory origin, such as the person may get a runny nose, or he could experience cough, or there could be airway obstruction, and airway tightening could be experienced, wheezing can occur, then laryngeal edema can happen, and asthma and rhinitis can also be felt by some of the food allergic persons. Then systemic symptoms, they involve certain problems such as there will be failure to thrive among the young children. They will not be able to grow nicely. Many of them, the persons, they would feel hypotension, that is lower blood pressure. There could be dysrhythmia, that means the heartbeat that gets disturbed, and this can lead to anaphylaxis also. So there are some neurological symptoms also, such as the person will feel headache, he would feel irritable, he will feel restlessness will be there. And let us talk about anaphylaxis. The systemic anaphylaxis, it is a severe allergic hypersensitivity, and it is a most dangerous allergic reaction which involves abdominal pain, nausea, vomiting, and then cyanosis, or there will be a drop in blood pressure. It can cause chest pain, diarrhea, shock, and death can also occur. Let's summarize what we have studied in this lecture. We had studied that adverse food reactions are a clinically abnormal response or reaction to exposure to food regardless of its mechanism. And it could be a reaction to toxic or non-toxic food item. The reactions are classified into four types, and out of these, one, two, and three type of reactions, they are antibody dependent, whereas the type 4, which is T cell dependent. We studied about three steps of allergic reactions. That is, first step is sensitization. That is when the food is added to the IgE. It stimulates the production of immunoglobulin E, and this is followed by the second step, that is early phase reaction, when so many immunoglobulin E they are produced and they are attached to the mast cells, and this leads to progression, that is the late phase reactions which come up. So these reactions, they are an outcome of long duration of that infection and repeated intake of that food. And then we studied what are the common reactions associated with the hypersensitivity. And lastly, we studied about the general symptoms and the severe symptoms of hypersensitivity. So we shall continue this topic in the next lecture. Thank you.